has followed us into the new one.
Even prior to the pandemic, we all had reasons to feel stressed, but new challenges over the past year to our daily lives are taking a toll on our mental well-being.
1 in 5 adults will experience mental illness this year.
We're really seeing an increase in calls for help and support and even just information.
The CDC survey found 63% of 18 to 24-year-olds reported symptoms of anxiety or depression. 25% reported increased substance use to deal with the stress, and 25% said they had seriously considered suicide. It's a hardship millions of Americans live with but don't talk about. Help us fight the stigma. Good afternoon, everyone, and welcome to our KSAT Community Virtual Town Hall, Resilience in the New Year. I'm Isis Romero. Millions of Americans struggle with mental health each year, but as common as it is, too many suffer in silence. Everything from stress and anxiety to domestic abuse and substance use, all of these issues have always affected our community and are now being heightened by the pandemic. Now more than ever, people are looking for ways to cope with the struggles of their world and their everyday lives. So we invited a group of experts to help our viewers open up about things that can be difficult to talk about and find ways to help our community begin to heal. Joining us today is Dr. Ralph Riviello. He is the chair of emergency medicine over at University Health. Before moving to San Antonio, he co-founded a sexual assault response center in Philadelphia. Evita Morin is the CEO of Rise Recovery Center, which helps teens, adults, and families overcome the effects of drug and alcohol abuse. And Tally Goldman-Dolge has more than 20 years of experience in counseling and is currently the CEO of Jewish Family Services, or JFS. They provide affordable counseling to all, regardless of faith, race, age, or sexual orientation. Before we get started, we want to remind those of you watching that there is always help and resources out there. If you or someone you know is struggling with mental health, and we have a few of those numbers for you to reach out to on our screen right now. To connect with a counselor, you can text the word HOME to that number there on your screen. It is 741-741. You can also call the Substance Abuse and Mental Health Services Administration National Hotline. Again, that number is also on your screen. Jot it down. It is 1-800-662-HELP. It is open 24/7, it is free, and it is confidential. You can also call the local 24-hour crisis helpline. That number also on your screen. Go ahead and jot it down, 1-800-316-9241. These numbers will be shown throughout this live stream, and you can also find them on our website right now at ksat.com. I want to welcome our panelists now. Thank you so much for joining us for this very important live stream. And I want to start by talking about this moment that we're in terms of this pandemic. This past year, of course, everyone knows has been unprecedented. And we know it has brought a lot of not just challenges for folks, but also some really serious increases in child abuse, domestic abuse, substance use disorder. And so I want to begin this dialogue by talking about what you're seeing in your respective organizations and fields in terms of these issues, and then we're going to try and expand on these throughout the hour. But Tally, I want to begin with you. What are you seeing? What are you hearing in people over these past several months?
Well, thank you so much for having me. I want to say that we are, like you just said, in such an unprecedented time period. JFS has been offering mental health services for 46 years, but during the pandemic in April, we saw an increase of clientele who wanted services up 300%. So we were able to figure out a way to sort of triage this and work with other organizations on how to get everyone the treatment that they needed. But I think that the pandemic has shone a light on mental health issues, as well as understanding that we all have mental health challenges at one time or another. So not only is JFS providing mental health treatment, but we're also doing education. And we have spoken on stress and anxiety during the pandemic and resilience over 46 times to different organizations and different corporations who have wanted to provide their staff and their constituents with as much information on mental health and wellness and taking care of themselves mentally than ever before.
That is a sobering statistic, 300%. Wow. Evita Morin, I want to turn to you now. You are the CEO, as we mentioned, of Rise Recovery. Can you tell us, first of all, a little bit about your organization and then also what these past few months have been like for people seeking treatment?
Sure. So Rise Recovery is unique in that we identify and understand that addiction and substance misuse starts very early. And so we capture that population. We serve people as young as age 12 who've engaged in and are already misusing drugs and alcohol, all the way up to age 35, because we understand that youth and young adults are special cohorts that need people like them, same age, same experiences that they're going through. They need to understand that there are people like them who want recovery. And so we provide that service to them and then also their families. Our focus is a wraparound, family-oriented program. We do it in our community centers. We go out into schools and all at no charge to those we serve. And, since the pandemic, we have turned on quite a bit our public education services, direct education through webcasts, through educational videos, and then a lot of telehealth, as I'm sure Tally has done. Our work really, though, should be in person. Substance recovery is incredibly hard in isolation, and there's only so much that someone can do for themselves by themselves. We're an interdependent community to be healthy, and so we understand that we need to stay together. We need to be back in our community centers, and people in recovery need to be around other people in recovery. So that's been the biggest challenge. We've seen relapse as a result of the isolation. We've seen quite an increase in substance use across our nation, substance overdose across our nation, and so that is something that we want to be ahead of. And when COVID first happened, immediately mental health providers like Tally and I were sensing that yes, we needed absolutely to address the bleed of the physical health crisis that was happening, but we knew a mental health crisis was coming, that would be the second wave, and we are in the middle of it right now.
Dr. Ralph Riviello, I'm going to call you Dr. Ralph for the purposes of this live stream. You work on the emergency side of things. Tell us about the ways in which the pandemic has impacted some of what you're seeing.
Sure. So I have to agree with my other panelists. We have seen increases in drug overdoses coming into the emergency department, substance use disorders, opioids, methamphetamine, alcohol. We've also seen an increase in people suffering from anxiety over fear of COVID or other things going on in their lives due to the disruption that the pandemic has caused. We're also seeing increases in depression, suicidality, suicide attempts, all coming into the emergency room to seek care. We've continued to see probably about the same numbers of women seeking care after domestic violence incidents or being assaulted at home. But I was just on a call yesterday with some national colleagues talking about the pandemic and its effect on violence. And we've seen that domestic violence hotlines have seen a dramatic increase in the number of calls to them during the pandemic because of isolation from work and having to stay at home, that there are more and more cases of that. And we were also talking about the fact that because in a lot of parts of the country, children are still being taught at home or staying home or not going to doctor's appointments, or doctor's appointments are happening via telehealth, that there's less opportunities for child abuse to be detected. So teachers, physicians, nurses, healthcare workers, social workers, and counselors all are trained to pick up on the signs of child abuse, or at least question whether a child could be abused. And now we're not having that contact with the children. So there's a big concern that a lot of child abuse cases are going unrecognized and underreported.
I want to go back to something that Evita just alluded to, and that is the saying, and we've heard it so much in the media, that we are in a pandemic within a pandemic. And this relates to a lot of things, a lot of those issues that you all just mentioned, child abuse, domestic abuse. We've also heard it said that we're in a mental health pandemic. Tally, when you hear that, what does that mean to you?
Well, I think, of course, I think we're in a mental health pandemic for several reasons right now. Just like Dr. Ralph said, with COVID came a ton of stress and anxiety that many people did not know how to work with or deal with. And a lot of people right now are suffering mentally in a way that they've never had to do before in the history of who they are as people. So I think talking about being in a mental health crisis right now, or a mental health pandemic, the fact is that we still all over the country don't have enough people working the front lines of mental health. We still don't have enough people in psychiatry, in child psychiatry, to help with the mass number of people who are wanting the resources and help right now. So we are really working in tandem with a lot of the hospitals and a lot of the other organizations to really try to help or to educate or to find large groups for people to have a platform or figure out how to talk about their mental health challenges right now. And that's why I think this is so important, because first of all, most people today don't know about the resources that are available to them. And I know we're going to discuss this. Mm-hmm. JFS and I know Rise Recovery, we do things either at a sliding scale fee or for free out in the community, whether it's individual counseling or substance abuse. So there are so many places out there, but people don't know or understand how to access this treatment. And then the other piece is still the transportation piece. 80% of those who receive an initial consultation for mental health never return due to transportation issues. That's a huge number of people who are not receiving the services that they need and then contribute to the crisis at hand.
Before we kind of delve into some of the causes and risk factors of mental health, I want to pull up a statistic that we got from the CDC and get some comment from Evita and Dr. Ralph on this. The statistic is, before the pandemic, 1 in 5 people in the U.S., 1 in 5, said they've experienced mental illness. In June of last year, so in June of 2020, at the peak of the pandemic, the CDC said that number jumped to 40%. So we were 1 in 5 before the pandemic. June, just a few months back, that's 40%. Evita, I'll let you comment on this statistic first. Does that surprise you?
No, sadly it doesn't. I think it's interesting because there's a parallel statistic of 40%, and that's for those who are who have expressed that they have increased their drug and alcohol use since this pandemic. There's been a 40% increase in that as well. And so there's a lot of stress related, either anxiety, depression, or substance use that's happening as a result of this. I think there's also 2 different experiences I think people are having. I think for some who maybe take for granted, but maybe are aware of their social support systems, their financial security, their physical health, their ability to access and navigate increased loopholes of care, this pandemic has been what I'll say fortunate for them. They have been healthy, they have been sound, their families have been solid, but that is a small percent for those who are experiencing isolation, grief and loss due to death from someone who's experienced COVID, unemployment. It has been incredibly traumatic, and there's very little in between. And so that's this gap of people who are fortunate and people who are devastated is you're either in one camp or the other. And so I think that's what's causing this enormous rattle of mental health issues.
Dr. Ralph, as you look at that statistic, what comes to mind?
Oh, well, we've been seeing it in the emergency room, and I think Evita hit it right on the head with all of the causes of it. We are seeing some illness related, so COVID related mental health concerns, but a lot of it is because of all of the consequences. And, a lot of times patients' safety nets get torn during the pandemic because they may have lost their support, they may have lost their job, they lost their health insurance, and now they're navigating a whole different set of circumstances and places that they're not been comfortable with, having to look for care without having health insurance, or how do they get their medications, and that just adds on to all of the stress, anxiety, depression that they're feeling. So it really becomes a never-ending cycle for some patients.
Absolutely. As we've been discussing, mental health disorders have existed long before the pandemic, but the pandemic has certainly compounded a lot of what people are experiencing. So I'd like to kind of shift our conversation, talk a little bit about the causes and the risk factors for someone who may be experiencing some mental health challenges. First, Tally, I want to talk about the symptoms. If someone believes they may be suffering from a mental health disorder, can you talk to us about some of the things that they may be experiencing or feeling?
Absolutely. Well, some of the really blinding things that people could be feeling right now are, of course, insomnia. So people's sleep is disrupted in a very different way than it's been before. A lot of people are talking about how they can't even fall asleep, or if they fall asleep, that they're up periodically during the night. So sleep disruption is one. Also, the fact that people are having problems with eating, whether it's eating too much or not getting enough nutrients during this period of time. A lot of people are saying, I really don't have any kind of an appetite right now. If you're feeling that way, there's definitely resources and things that you can go to. Pay attention to your body and the things that you do. Also, a feeling of, I don't really want to get out of bed in the morning. That's a really big indicator right now that something's going on. And I hear this all the time. And of course, there are days that all of us are like, oh my God, we're going through the same thing over and over and over again. But if you continue to feel that way and feel like I really just can't seem to get out of bed, that's a very big indicator that something is going on with you mentally. Another thing, we understand that right now during this pandemic that everyone is isolated in their own way. But there is extreme isolation, which means that you take yourself away from everything. You don't want to do work the way that you did before. You don't want to see or talk to friends, even if it's on Zoom. You don't interact with people the way that you did. A lot of people are losing connections, and I think we'll talk a little bit more about isolation and what that's done for not only the substance abuse community, but of course for the mental health community, which are two big indicators that something is going on. So really, if you want to just summarize that again, is really to look at your sleeping patterns, your eating patterns, how you're communicating with other people. And again, if you're staying in bed and you are just not wanting to get up, we get it. This period of time is like no other, but those are huge indicators that will help you.
As you were mentioning, and I want to just kind of ask you a follow-up question really quickly, if I may. As you were mentioning some of these symptoms or things that people may be experiencing, do you find in your line of work that people have a hard time seeking help? People have a hard time identifying this as a mental health challenge? Absolutely. I think during this period of time, people are having a hard time just deciphering and figuring out, is this a mental health problem or is this something that's just normal because of this period of time? Most of the time right now, every single one of us has gone through a piece of trauma because of what's happened over the last year. And it's how we react to it. It's how we bounce back. It's about our resiliency. It's about the work that we've done in therapy prior to this, or how much we want to learn about ourselves during this period of time. Those are big pieces to help us. Absolutely. Evita, in your opening remarks, you mentioned opioid opioid overdoses. You mentioned stress drinking. When we talk about substance use disorders, are there particular risk factors to be aware of that perhaps may make a person more prone to using substances? This is either, in the past year, through the pandemic, or even pre-pandemic.
That's and I think it's really important to note that, there's trauma-related mental health issues that are happening right now, and then there's every other mental health issue that normally occurs because of unpredictable chemical imbalances, or there are so many other issues that can cause mental health issues, not just COVID. So if you're not feeling like that's what's bothering you, that's certainly not a reason to ignore those symptoms. I think it's really important, and again, because I focus on young people, for parents listening, the earlier kids start engaging in drugs and alcohol, the more their likeliness for later abuse increases, later misuse, later addiction increases. So it really is that first time that child picks up alcohol or a drug of some kind that starts to expose their brain before their brain has fully cooked to adapting to this new chemical that's in their system, and then changing their chemicals of their brain over time. So my first, certainly advice to any person with a young loved one in their family is to do what you can to mitigate that risk, to keep the drugs and alcohol out of their access. It is so important. And it's not even about a social acceptance issue or cultural issue. It is about brain development and the fact that their brain is not developed yet to handle that. I think the other piece there is obviously stress. And more than that, it's a social normalization of drinking that I have seen increase 1,000-fold since this pandemic has happened. I think if anyone has scrolled their social media feeds over the last few months, they'll see this very permissive, very normalizing drink culture that has allowed people to feel like that is the coping skill that everyone is using. That's the coping skill I should be using. Absolutely, we all need coping skills, but I think making sure you have a variety of them in your toolbox to deal with stress is so important. And if you find yourself ruminating about when you can get that next drink, or when 5 o'clock hits, or when that's what's on your mind, then that's probably a good sign to expand your coping skills for getting through really difficult times, because there's no question we're all going through that.
That's really interesting that you would bring that up about the drink culture. That's something that I've certainly mentioned or certainly seen scrolling, on Facebook and social media and whatnot. Dr. Ralph, I want to ask you about something you mentioned also in your opening remarks, which was the increase in suicides and suicide attempts over the course of the pandemic. I'm just kind of interested to understand if there's a certain either part of the population who is most at risk for thoughts of suicide, or are you seeing it just kind of across the board in terms of age groups, even, racial and ethnic populations? And then kind of talk to us about some of the warning signs to look for.
Right. So we've seen it across all age groups and race, ethnicities, and that. But there are some risk factors, of course, those who are more isolated, those who have less access to resources. Often the elderly are more likely to attempt or complete suicide. We also see it a lot of times in our homeless population, with different ways they attempt it, but we do see it a lot in those. And of course, in patients with substance use disorders. So we see it across the gamut of all individuals. And I have to say that when we talk to these patients in the emergency room, a lot of it stems from the fact that they just don't see hope. There's just a lot of hopelessness. They've reached that point where they don't see any chance of getting out of whatever situation they're in, or that there's any light at that end of the tunnel, and this is the only option that they see. I think some of the warning signs have become harder to detect because we are being more isolated. We're staying at home more. We're not going out with friends and family. Our work circles are very different now because of Zoom and work from home. So I think it's sometimes hard to pick up those, subtle signs when somebody's really in trouble. But, some of the big ones are like somebody who becomes even more withdrawn, somebody who may have more anxiety over different things in their life, which wasn't there before, more use more use of drugs and alcohol, more out of control kind of behaviors. But it is really tough. It's always been tough to sometimes predict or detect somebody who is suicidal until they really are suicidal or they do something. And I think the pandemic has just made it even worse.
Over the course of the past several weeks, we've been asking our viewers to submit questions to pose to you guys. And I want to go through some of those viewer questions because we have received quite a few. The first question, and Evita, I want you to answer this one. It is, how do I persuade, support, convince someone I care about to seek professional help for their mental health concerns? Where do we start?
That's a great question, and it's one that I think can be applied equally for mental health issues or drug and alcohol issues. I think first it's important to know that it is rarely easy to make a decision to try and help someone with an issue. So if you've reached that point, good for you. You know that that's a sacrifice, and you know that your loved one will have a greater chance of overcoming whatever it is they're dealing with your support. Every situation is unique, but some general guidelines that I'd like to suggest is, one, expect it to be difficult. Brace yourself for that. There are a lot of reasons for that. That person may not agree they have a problem, but you see it. They may not may not be willing to change what they're doing or fear consequences of admitting it. I know for mothers who've got a drug and alcohol addiction, they fear losing their kids. They're not going to admit that they have a drug and alcohol addiction. Or they might just be embarrassed and not want to discuss it with you. Find someone who they might feel comfortable discussing it with. The same with talking to a professional about it. They may feel like that's too awkward a conversation. And so processing that, dealing with what you can do is focusing on building trust. Spend some time building trust with that person you want to help. If you want them to change, you will probably have to try and change some things too. If you've got a very strong, if maybe a parental relationship or a partner relationship, if you show you're willing to try, your loved one may be more likely to try as well. And this is not even about you necessarily having an addiction too. It could just be that they share that they've got that you are causing some of their behaviors. Now, that is not necessarily true, but it's important to be aware of what you are doing to help or hinder that person. Be honest. Also be prepared for blame. Don't be surprised if your loved one expresses that you've done something to contribute to their addiction. And then respect privacy. It is no one's business if your loved one decides to go to treatment except for theirs. It is no one's business but theirs. If what they discuss in therapy, give them that space to have this journey, because this is a very, very personal journey for everyone. Some things not to do: don't threaten. It can be frustrating, I know. Remember that change is incredibly hard, and it's their change they have to make. Don't criticize, but be honest about your feelings. So telling your loved one that what it's been like for you, and be honest about it, and being honest about what your boundaries are, is really important. And you can do that without criticizing. And also, don't expect immediate change. Recovery from mental health, from addiction, is a journey. There are so many approaches to treatment, and no change happens overnight. I think the final thing is get help for yourself. Before you do anything, get help for yourself. Being in a relationship with someone who is struggling with mental health issues is incredibly challenging, very stressful. There are support systems, support groups through NAMI, through Al-Anon, through Rise Recovery that you can engage in if you have a mental health or substance use issue in your family, and develop what stress management strategies are going to be good for you. You are in recovery from loving someone who is struggling, and so acknowledge that and take care of yourself.
That's great advice. Thank you so much. Dr. Ralph, because you work in emergency care, I want to pose our next viewer question to you. This one comes from an anonymous viewer who's asking about how and where to help my adult son with mental illness. This person states he was taken to a crisis center yesterday and he is already coming home, and we don't understand why. Can you speak to this person's question about how and where to help their son?
Sure. So, crisis centers are a great resource to link people to mental health treatment, mental health services. But one of the, big concerns of people who work at crisis centers is to make an assessment whether or not the patient is a harm or a threat to themselves or their own well-being or the well-being of others. And it's at that point that we could, force treatment or put somebody on an emergency detention to get treatment for whatever problem they're having. It becomes tough when they don't meet those criteria, and they're pretty strict criteria because we just don't want to have to do that to everybody or have it be a chance to do it to everybody. So there are really strict criteria that have to be met. So if you're not meeting those criteria, you become a voluntary patient where you could still dictate and determine your own mental health needs and desire for hospitalization, desire to take medications, and that. So just as easy as you could decide to accept the treatment, you could decide to refuse it or change the treatment plan, and that. But I think one of the keys to this is being supportive of your loved one, but also getting as much information as you can. So hopefully the Crisis Center reached out and spoke to the family members to see what their concerns were as to why the person needed crisis help or more immediate help. And then hopefully the family reached out and expressed their concerns about him coming home and what they could do at home to help them. A lot of times I find that these conversations need to happen both ways, from the hospital or crisis center to the family to the crisis center or hospital. And just like Evita had mentioned, even with substance use disorders, we see a lot of times patients, families in the emergency department demanding that we put them into rehab or that. And, rehab doesn't work unless the person who's using the substance wants the help or wants to go into rehab. And I can't force somebody into rehab. And I think that's sometimes heartbreaking as a clinician to see the caring family member really have a lot of struggle with that notion that they want them to get help. Why can't I make them get help?
Yeah, for sure. Our next couple of questions kind of pertain to the same thing. So Tally, I'm going to let you take these next two questions. This viewer asked, is there an organization, and I'm asking it to you because you mentioned some of the resources that you guys provide, is there an organization that helps people pay for mental health bills, such as in-stay or intensive outpatient care facilities? Is there low-cost mental health insurance? And then another viewer asked something very similar. This viewer says, I'm trying to get some resources for my niece who has a mental illness but has no insurance and funds to pay. She is needing therapy and meds. If you could address those two questions in terms of where folks can go for that help.
So as I said, JFS, Family Service Association, Rise Recovery, these are organizations that actually do, again, they will see you without insurance, and we will be able to assess for psychiatry reasons and also counseling at a reduced fee. Usually, so I will tell you right now that we have seen so many clients who have asked for an even bigger reduction in fees that we are actually only charging for some of our clients $5 to $10 a session to see a therapist right now because of the economic crisis that people are going through. So the question about insurance and paying for inpatient treatment, that's a really difficult one. There's not a lot of places that are able to assist with that I know of, and maybe Ralph and Vita would be able to help you with that. But what we do at JFS and other social service organizations, we help you and we guide you with case management and help you to really find the right fit for you. We try and find inpatient that may be able to take Medicaid or Medicare. So there are options out there. And there are services that will help you navigate this healthcare system that can be very difficult at times to really figure out. So I'm not sure if there are any other resources that you, Evita or Ralph,
I can add to that.
Sure, go
Sure. Thank you. We, for behavioral health, which is substance use issues, there is a local 24-hour helpline. There's one person answering the phone dedicated, every hour. So be patient with us, please. But please don't hesitate to use 210-SAY-CARE, 210-SAY-CARE. And I think you have that number available. So I just want to also note that what we recognize that there are maybe more limited mental health resources that are no insurance, but there are quite a few treatment facilities and nonprofit treatment facilities that will support no insurance patients who need support. And you can start again through 210 Stay Care. You can call. There are a few resources. I would start with us and take it from there.
And Dr. Ralph, I believe you had another reference you wanted to give folks in terms of the Bexar County Department of Mental Health. Will you tell us about that?
Sure. So one other resource is through the Bexar County Department of Mental Health. You could call 211. As another resource, you could go to 211texas.org. So either just call 211 or 211texas.org, and they should be able to help you with resources.
And again, in terms of those resources for folks who are watching this live stream right now, and I know had the numbers at the beginning of the live stream. If you go to KSAT.com right now, we also have those available for those of you looking. Moving on to another viewer question. This is an anonymous viewer, and Avita, I want to pose this one to you. This person asks, I find myself questioning everything I do, and that I'm inside looking outside, and I don't like doing this. How can I stop?
I really relate to that question, and I have experienced that feeling before. I think for some people it can feel like you're behind a glass wall, and from the rest of the world, or that you're a fly on the wall of your life, hovering above yourself. Some people say it can even feel like you're the normal one and everyone else seems like they're on autopilot. These are all signs of something that is commonly called dissociation, depersonalization, derealization, all fancy words for basically your body and mind checking out. It happens when something is happening around us or to us, like a pandemic, like sexual abuse or family violence. Experiences when our minds need to escape something that our bodies can't. So it's like our mind shutting all its windows to the world so cold air can't get in. And it's very protective and it's very helpful at first. So please acknowledge, have grace for yourself. It's normal if that happens to you, but sometimes it can go on longer than we intended, and we start to feel isolated in ourselves. So some ways that we can get out of that, some helpful tips that have worked for me. Grounding is a type of intervention. You can do it through counseling, or you can do it in your own home. Grounding is essentially engaging your senses purposefully. Engaging your sight by going outside, your sense of smell by putting on a candle, things like that can just bring you back to where you are in your own body. Talking to others is really, really important. There are support groups. Telehealth, social media support groups that even exist. That's a great use of, sometimes the challenging space. Social media are these enormous private social media support groups that you can find other people like yourself to not feel alone. And then adding special routines to your life is also very helpful. Your body can feel safe in routine, and that usually helps kind of ward off that feeling and bring its guard down. Treating yourself to a nice coffee, putting on your favorite songs, going to bed at a certain hour. Like Tally said, keeping track of your hygiene physically and mentally. And then this is a hard one. That helps, and that's planning something to look forward to, especially if it's outside. This has been the biggest challenge of 2019 and entering into 2020 is having something to look forward to. And I can say what our family did was we explored for the very first time in our lives our beautiful state parks. And we found that there was adequate privacy and space that we could do that safely. We got outside, we put it on the calendar and had something to look forward to that kept everybody just a little more sane and a little less anxious and outside of themselves because of what's going on. And then finally, see a therapist who can screen you for underlying mental health issues.
We've done the state park thing too. For the record, it's great. I want to get to another viewer question. This one is asked by a viewer named Belinda. Belinda asks, I know from personal experience that mental health is very important and difficult, but is there any actual cure for it? Or do we have to take medicine for the rest of our lives to deal with mental illness? Tally, I want to give you a chance to comment on this one first.
So I actually want to talk from personal experience, Melinda. And understand that I think mental illness is something that may not ever be able to be cured, but it goes in and out of remission throughout your life, depending on how you take care of yourself. I am somebody who is a vocal advocate for mental health because I myself had suffered from panic disorder at a very young age, and I had severe anxiety as a child. I will tell you right now that I could not be happier or more. I feel so proud that I was able to actually be born with something that has caused me to really look at life in a different way. So I actually look at it, and it sounds very Pollyanna, very princess-like, but I look at it as a superpower in a way. I'm able to look at life differently. I will tell you that the struggles were so tremendous at times that I didn't know if I would be able to get through those struggles. But when I did, I realized my own strengths and my own resilience. And that's what I think people who suffer or have mental health challenges do. We will go in and out of periods of time, just like life in general. I want to tell you, life is about ups and downs. And some people who suffer mental health challenges, their ups may be way up and their downs may be extreme downs, but they know how to work with it. If you, just like Avita said, I think there are so many things and resources that we can do these days to keep ourselves mentally healthy. Besides just seeing a therapist, I connect with other people who have also experienced mental health challenges. I talk, I tell my story. These are all things that have helped me to be where I am today and to feel comfortable knowing that I will experience anxiety and do at different levels during different periods of time. But I have the resources. I have the strength to deal with that. And I also have, like, what I love what Avita said, and a lot of people say this is a little cliche, but to have your own toolbox. The things that I take out on a daily basis in order to help me so I don't go sort of down that rabbit hole of anxiety where I don't feel like I can get out of it. I'm not there anymore. So that is a long answer to a short question. But no, I do not think that I don't think there's a cure, but there are so many resources. And also it's the way we look at things. And if we're able to kind of change our thinking around mental health and that we all are human, it can be a really beautiful, empowering thing.
Absolutely. And Avita, I want to give you an opportunity to expand on that. You know, when folks go into Rise Recovery, are they expecting a light switch to kind of just go on and a set time to where, you know, the recovery will take place? Or it takes place in a certain amount of time and then you're done? Or is it a lifelong process?
That's, most people come into Rise Recovery not wanting anything to do with recovery and somehow find it there. And so, oftentimes parents will expect that change or say, why do I need to be here? This is their problem, not mine. And like addiction, I think mental health issues, it's a family disease, what we're dealing with. And so when we can all wrap ourselves around the problem, we all get better together. Mental health issues are as common as physical health issues. We just find it harder to talk about things that other people can't see. I think it's really important to remember that. We fear the risk of looking crazy because other people don't see it. But just like physical injuries, recovery from mental health issues is a process. And I just want to take note of three things that are common causes for that. One is traumatic experiences, things outside ourselves that impressed our brains and bruised our brains and made us hurt in our minds. Another is just being born with chemical imbalances to no fault of anybody, but the genes we're born with, and or doing it to ourselves through that drug and alcohol use. If you use drugs and alcohol long enough, you will change the chemicals of your brain and create those imbalances that can cause some of these mental health issues. And the third often overlooked one is having a physical issue. Many physical issues, like thyroid issues, for instance, can cause symptoms that look like depression or other mental health struggles. And so it's really, really important that you don't rule that out, that you rule that out, that you check with the doctor, you get an effective diagnosis of what your problem is, and not be ashamed to talk about it with somebody, a professional, going to therapy, going to peer supports, and then engaging in healthy lifestyle behaviors. If you have a healthy body, your mind will follow suit. So it's really important to try and, drink less if we can. I myself I'm not in addiction recovery from drugs and alcohol, but I choose not to drink alcohol for many reasons. For my own mental health, I am also in recovery from trauma and mental health issues, and like Tally, am a grateful survivor of that. And then it's really important to have a plan with your loved ones if a relapse or recurrence happens. What steps you want taken if your loved one and yourself find yourself in need of crisis help. So make sure that you have those conversations so that you feel taken care of if you can no longer represent yourself because you've gone too far into a mental health crisis.
Absolutely. Historically, there's been, and you guys both kind of talked about it, this stigma when it comes to seeking help for one's mental health, or even speaking out or speaking up about abuse, whether that be in the home or child abuse or what have you. Dr. Ralph, I want to ask this next question to you. What would you say to someone who thinks seeking help is either a sign of weakness or speaking up is a sign of weakness?
Yes, that's a very good point. And I've actually said to people in the past, well, you wouldn't criticize somebody because they came to the hospital because they broke their arm. You wouldn't, say to somebody who's having a heart attack, well, that's an embarrassment. You shouldn't, should fight through it. You should be able to handle this, or you should be able to fight this, and that. So people with, substance use disorders, mental health illnesses should not have the same things hurled at them. They should not be held to that, it's your fault. You could make this better. You're the one doing this. And I think we see that a lot of times when people have relapses from their addictions while they've been in recovery. And I've seen family members, even some healthcare workers and others, put the blame on the patient. We would never tell a cancer survivor that, oh, you came out of remission because it was your fault. So I don't think we should do that. It's very bad. And we should still be there as healthcare workers, professionals, as family members, loved ones, et cetera, to support the patient, to support our loved one, our family member through this battle again. And, hopefully they'll come out victorious at the end.
Great points. Tally and Avitha, you both kind of shared some aspects of your own personal lives, and so I want to pose a personal question to our entire panel. I will start with you, Tally. How have you as professionals in the field been working on your own mental wellness during this time?
Well, I'm going to be honest with you. I will say that this last year has been extremely challenging. Running a mental health organization, speaking on mental health, and trying to kind of put on that brave face every day has been challenging. So I have had to do a lot of self-reflection and a lot of self-care. And some of the things that I'm doing, we've mentioned already. One of the things is that I need exercise. I need exercise at least 15 minutes to at least 45 minutes a day. It helps me kind of clear my head. I don't care if it's a walk that I have to do, or that I get on, I'm lucky enough to have a machine in my house that it's an elliptical, and I do that. But it really gets me out of the place that I'm in. I also had to put boundaries on things that I do during the day. We're all many of us are working from home right now, and the boundaries of work and home life are blurred in such a way. So I really have to shut off my phone, the computer. I don't answer texts even unless I see that there's an emergency after a certain hour. And I think the biggest thing that I've done, and I talk about this actually in my talks on resilience, is I needed to find something that was just mine that I could be proud of during this period of time. And so what I did was and I suggest this for anybody, is start a gratitude journal. And so every single morning since March, I think it was March 15th or 16th, I have to write down 5 things that I'm grateful for. Now, the caveat is it cannot be 5 of the same things. So since March, I have not been able to write my family, my family, my family, my family, my friends, whatever. I actually had to find real tangible things that I was grateful for in a day. And let me tell you, try doing it, or even try doing 3 for the next month, and you will see the challenges. But I can't get out of bed in the morning now until I really see those things. And I have been able to look at my life differently. And I also have been able to look at the things that I want after this pandemic. And I think that both Ralph and Evita said it beautifully, is about hope. So I needed hope. And I will tell you, my gratitude journal and being able to look through these months after months, almost a year, of 5 different things a day, what that has done for me emotionally has been tremendous. And of course, I will tell you, I still go to therapy every single week.
I love the idea of a gratitude journal. I'm going to start one. Thank you so much for that, Tally. Evita, what about you? How have you been working on your own mental wellness during this time?
It's been a journey. I think, I'm a mother of 2 little kids who are home learning, and my husband was successful in his personal career until he had to take a stop to take care of our kids while I run this organization. I've been so fortunate for the resources, but it's been quite a challenge to carry a load like that. And so I've had to give myself a lot of grace, and I think that's really important for all of us. Is we may try and dress ourselves up for the Zoom meeting, but we really need to admit to those people that we trust and love us that we are imperfect human beings going through this very imperfectly. I think, I definitely hit a wall during this. Probably about halfway through, I needed to just take a week off and recover. It was not even for vacation, but just to recover from the mental exhaustion, the physical exhaustion of so much new. And when you have to incorporate so many things that aren't natural to us, that are not habituated to us, you can't be on autopilot. And when you can't be on autopilot because you know what to expect, your brain just burns out. And so acknowledge that is what so many of us are going through. And if you need a break, you deserve a break. Take that break. Reaching out to friends was another thing it was a big mistake. I put my friends on the shelf because I thought I'll get back, first of all, seeing them during COVID is no. And I've got to prioritize, keeping this organization running and keeping my family running. And I stopped paying any attention to what I needed for myself. And that was a big part of, I think, my hitting that wall. And so now I have prioritized I'm a social person by nature. I am an extrovert. So I realized friends are vitamins to me, and I need to spend more time carefully engaging with them in a way that keeps me full so that I can be full for everybody else who needs me.
Connecting, yes, certainly important. Thank you, Evita. And Dr. Ralph, what about you?
Sure. So, a lot of the same stuff that my co-panelists have mentioned have helped me as well. Being more aware of what I'm putting in my mouth related to food. I was always the person who went to the carb for comfort and that. So we're trying to be a little bit more careful at home of what we're buying, what we're keeping in the cupboards and that kind of stuff. But I'll tell you, one of the things we enjoy doing is traveling and, going to Europe and other foreign countries and we haven't been able to go, and it doesn't look like we're going to be able to go in the near future. So we've had to really think about what other things we could do. So, time with our friends, whether it's on the phone or through, social media and Zoom or those kind of things, keeping in touch with loved ones. A lot of my family lives away from here. So, touching base with them, checking in on them and their well-being. But I have to say it's really tough. And sometimes we just need those moments where we're just zoned out and either watching something on TV that we don't care about, that we really don't even know about, and we're just in our own little world. And, it's it's like we're plugging ourselves into the charger to get that juice ready to go again.
As we're closing out here on the last few minutes of our live stream, the name of this live stream is Resilience in the New Year. And that word is really special, resilience. Tally, I want to give you an opportunity to just talk about what that means. What is resilience, and how do you know if you have it?
So, first of all of us have resilience. And the definition of resilience is adapting well in the face of adversity, trauma, stress, or difficulties, and that bouncing back in the face of adversity. And I want to say we have all done that during this period of time. But what I will tell you about resilience that is the most beautiful thing is that none of us are born with it. It is all skills we have to learn. And some of the things that we could practice in terms of promoting resilience is our own self-awareness, our own emotional regulation, realistic optimism. And so everyone's like, what is realistic optimism? Well, it's not being that person who says, everything's great, it's perfect, my life is great now. No, it's actually saying, you know what, it's okay. Or I'm looking forward to this, or I hope for this in the future. That's realistic, not saying everything's perfect all the time. I think we all have gotten in that habit, and that's something that we could work on. The other thing that has been mentioned several times here is connection. I know we're not connecting in the same way that we've done this before. We're connecting in very different ways. But right now, even doing this incredible KSAT mental health town hall, we're connecting. We're connecting with other people. What does it look like? How are we going to do things differently? I'm listening more. Being able to listen is another incredible form of connection. And then problem solving, figuring out, how am I going to get through this? What does this look like? Solve your own puzzles. So these are, again, I want to continue to say this, these are acquired skills. We develop them. Every single one of us has the capacity to develop them. And I'll tell you that all of us have been doing that all along, but having the realization that you've been doing that during this time, you really need to give yourself like a big round of applause, because there's nothing more beautiful than the fact that we are all resilient and we are going to make it through this period of time.
Absolutely. Before we close it out with some final thoughts from all three of our panelists, I want to ask this last question to you, Evita. I want to talk about what happens after the pandemic. The end of the pandemic is a day we're all anxiously waiting for. What do you see as some of the biggest obstacles in working with people after the pandemic?
That's a great question. I think in some ways it's, we can, now that we are recognizing this as a crisis, we are starting to see resources rally around and support during a time of crisis. But oftentimes when the crisis ends, the resources disappear. And I think we need to be very mindful, and our community does, especially those agencies that support places like the emergency room, like nonprofits, like social services, that we need to continue. People will be changed. An entire generation of people will be changed. Kids who have lacked education will be changed. So we need to stay with them. We need to stay with this. We need to follow them through that journey, get them back through their recovery, and not give up on them. And to Tally's point, the bravest words I have ever heard are, "I need help." They are truly the hardest words to say. And just don't be afraid after this pandemic is over to feel like you're not good enough for that help. You deserve that help. And speaking up is the best and bravest thing you can do.
And before we go, Dr. Ralph, we're going to pose this question to all three of you, but I want you to give some final thoughts, a final takeaway message for our viewers as we end this town hall. Dr. Ralph, I'll start with you.
Sure. So I'm going to actually steal it from Evita and say, if you need help, get help. There are resources. You may not think they're there. You may not know where to access them, but reach out to family, friends, your healthcare provider. We can help you find that help. And I think that's one of the biggest takeaways from the whole pandemic, is that we need to help each other, and we need to seek that help when we need it.
Tally, final message.
So I just want everyone to realize that your mental wellness is just as important as your physical wellness. You can't have one without the other. I think that this period of time has shown a bright light on that. And the fact that this period of time has helped people understand and want to explore their own mental wellness. And it has worked on destigmatizing getting the help that people need so desperately. So if we can be thankful for anything, it's the information, it's the education, and it's the wanting to change and be better for everybody.
And Evita, your final thoughts.
My final thoughts would be that, there are many people, viewers who might want to make a difference, might be inspired to take action. And I think the first thing that we can all do is change inward and make sure that we are the healthiest people we can be so that we can give that health forward. Instead of taking that trauma with us and trying to feel other people's trauma, let's be healthier together so that we can help those other people who need us.
Some great takeaways. I want to thank all three of you for your time, for your expertise. We appreciate it so much. And before we go, if you would like to learn more about mental health resources, you can head to the KSAT TV app on your streaming device. Episode 20 of KSAT Explains is streaming right now on Apple TV, Amazon Fire, Roku, and more. Myra Arthur, RJ Marquez, and the Explains team spoke with dozens of San Antonians who have felt the effects of the pandemic on their mental health, and they explore more ways that San Antonio can heal as a community. Again, you can watch it for free any way you stream and on KSAT.com. That is all our time. Once again, Evita, Tally, Dr. Ralph, I want to thank you so much for your time and for your expertise. And of course, thank you, all of our viewers, for watching. Have a great afternoon.